welcome to another Fresh RN video, and we are going to be talking about what it's like on an orthopedic nursing unit. So the first thing is that there is a lot of throughput on an ortho nursing unit. So what that means is admissions, discharges, and transfers. Patients coming into the unit and going out of the unit and facilitating that process. So you may start your shift with 5 ortho patients, and throughout that shift, maybe you discharge 2 or even 3 of them. Maybe they go home, or maybe they go to a rehab facility or a nursing home, and then you're going to get 2 or 3 patients back. So you'll start the shift with one set of patients and end with another set of patients, and all the while making sure that you're, taking care of that patient wherever they are in their journey of, recovery from the procedure and then getting discharged. So it's fast-paced in the terms of, dealing with a lot of different patients throughout the shift. As an ortho nurse, you're also going to be dealing with a lot of drains, devices, wounds. Oh my. All right. So you're going to get very used to these surgeons that you're working with and their preferences post-operatively. Some like to have specific drains in specific places, and they have a way they like their, post-operative knee replacements, the TKAs wrapped in a certain way, or have a certain drain, whatever that might be. Or, you might have patients who had trauma and they may have external fixators and all that kind of stuff. You're going to get very used to dealing with those kinds of devices, managing them, teaching your patients about them, knowing what the providers want and what kind of issues to anticipate with them. Lots of drains, lots of devices. The next thing is that on an ortho unit, you're going to be giving a lot of pain medicine. Your patients have very painful procedures. Even the most healthy patients, those who go in for a knee replacement, are going to have excruciating pain afterwards. It's not if they have pain, it's they will have a ton of pain and we have to control it, okay? Not eliminate it, but control it. So when you're on a nursing unit that is orthopedic in nature, you're going to be giving a lot of pain medication. That's going to be one of the things that you're noticing and getting a report. Hey, this is the last time they had this. This works well for them. We do it this far apart. They have this scheduled, this as needed, and that's a crucial part of your patient management. And finally, you on that ortho unit are going to see physical therapists and occupational therapists a ton, okay? So on that, in the morning, you're going to get a report on your patient and learn what surgery they had, their history, all that jazz. But one of the most important things you're going to hear in a report, in addition to pain management and just general goals, is what the deal is with therapy. What does therapy want them to do? How much did they do with therapy? How did it go? What pain medications did we give them beforehand that enabled them to participate better? What are their goals that we need to meet before they're discharged? Do they have the recommended resources set up that they'll need at home? If maybe therapy saw them yesterday and they need a shower chair, they need a lift, they need whatever it might be, we're working with therapy to help understand what those things are, and then letting case management and social work know so we can ensure that those things are there for the patients at their home or wherever they might be going. So there's a lot of collaboration between disciplines. The nice thing about ortho, though, is as you get used to your surgeons, as you get used to your therapists and your case managers, you really get into a very good groove with it, okay? You know the obstacles, the common issues you run into, and you can navigate those with ease once you get used to it. And you can also anticipate needs and anticipate, oh wait, I know that in these situations, typically Dr. Smith likes to do X, Y, and Z. Let me double check, and then you chat with them and you already know what they probably want, and they're like, hey, great, that's exactly what I'd like to do. And it feels great to be able to be this very integral part of the healthcare team. And being able to kind of coordinate all of that with confidence, because you will get used to it. You will get into a groove, and it's very rewarding to have that role, because these patients, they're in a lot of pain. They're uncomfortable, and they are at your mercy in terms of pain management and ensuring all of this stuff gets facilitated well. So it's very rewarding working on an ortho unit. You certainly get into your groove and can really make a difference in patients' lives, and also the lives of the colleagues that you're working with, because they can depend on you, especially those physicians. They trust you. They are they want you to have their patients. Like, to be that nurse is really cool. So I have an ortho nurse resource called the Ortho Nurse Crash Course. We got a link to it in the description of this video. And one of the things that Elizabeth, who is a nurse practitioner at one of the best hospitals in the country, working in the orthopedic department, has said is, you know, the orthopedic surgeons do have their favorite nurses. They do, you know, say, oh, okay, I've got this very complex patient, or this patient with these very specific needs, and I need to know beyond a shadow of a doubt that they are in the hands of someone I trust. And they will call the nurse manager and they will say, I have Mr. you know, Jones here. He's going to have a total knee done today, and I need Katie to be his nurse. I need that to happen today. When is she working? Is she working today? Or how, you know, and to be that nurse feels awesome. And if you need and want to learn and fill in those gaps of all of the ortho unknown, that Ortho Nurse Crash Course does exactly that. So check that out in the link in the description of this video. And thanks, nurses. Stay fresh.